I'm Dr. Krishnamurthy Bonanthaya. I'm the scientific chair of this 13th International Congress on Cleft Lip, Palate and Craniofacial Anomalies being held here at Chennai. I am also a consulting maxillofacial surgeon at the Bhagwan Mahaveer Jain Hospital at Bangalore, where I run a project for the New York based NGO Smile Train, taking care of children with these deformities. This Congress is an event that happens once in 4 years on behalf of the International Federation for Cleft Lip, Palate and Craniofacial Anomalies. This federation is actually a group of all national associations of cleft societies around the world, and they meet once in 4 years to update their knowledges, bring in state-of-the-art technologies, and disseminate information and skills and knowledges to people who take care of children with cleft lip and palate around the world. This conference is decided 8 years in advance in 2 conferences before, and it's a process of bidding by all the countries that are interested in hosting the events 8 years hence, and we won the bid to host this meeting at India when the voting was held at the 11th international meeting that was held at Brazil in 2009. At that point of time, a lot of people from around the developing world felt that a huge magnitude of work is happening in the developing world, that we are contributing a significant amount towards patient care, research data, and it's only appropriate that a meeting of this magnitude be held in these parts of the world, and therefore we found significant support from nations around the world for us to host this meeting, and we won a bid where 4 other countries were competing, and that's how this meeting is happening in Chennai this year. The reason why we decided to bid for this meeting was that this is a country that has millions of patients who are born or are going to be born with this deformity, and though we do provide state-of-the-art facilities as well as treatment to these patients, we still have a long way to go in terms of developing more trained manpower in certain subspecialties of this. Also, it's important that people in this part of the world gain from the cutting edge technologies, and these were the reasons that made the Indian Society of Cleft Lip, Palate, Craniofacial Anomalies to go for this meeting. This is a huge burden. The magnitude of this problem has never been assessed properly. We have the government of India that has the Disability Act, which classify physical disabilities in various parts of the body, but unfortunately cleft lip and palate is not considered a disability. The reason being, a lot of thought has not gone into what problems it causes. More than being a cosmetic problem of a defect or deformity on the face, which it is more of a functional problem, for the simple reason that if somebody has a cleft of the palate, they may not be able to speak normally, oftentimes even after repair. So it is a significant functional problem. You will agree that in today's day and age, communicating with your colleagues, with your peers, with your family and friends, to get your viewpoints across is so important, and speech is such a fundamental part of our everyday life, and this is something which gets significantly compromised if the repair is not done or not done properly. And I believe the concentration of the cleft care professionals, or even people in the business world who would like to contribute towards care, should be towards reducing this burden, though there is a cosmetic element involved, because nobody wants to have a big hole in their face and be walking around with it. This conference is being held over 4 days. The first day being devoted to continuing education programs, and the next 3 days for the main events of the Congress. So we had 6 continuing education programs on different sub-disciplines of cleft care. that was held simultaneously yesterday, that is the 8th of February. It covered the whole gamut of cleft care, starting with the surgery, with speech therapy, with orthodontic therapy, with the psychological aspects, with the preventive aspects, how to prevent clefts and what is the work that is being done at this point of time. Is there a hope that we can completely prevent these clefts in the future, was also discussed at a continuing education program. And also importantly, we had contributions from all the non-governmental organizations, the NGOs that take care of these children, come together and debate the issues. So we had a whole ranging discussion on all issues that are involved in this continuing education program on the 8th of February. In the coming days, including today, we are once again discussing state of the art, cutting edge technologies in cleft care, in terms of providing better surgical results, in terms of providing better speech results, and also in providing holistic outcomes. As you are all well aware, there is a significant shift in the way we look at outcomes of treatment for diseases. It used to be processes driven, where we counted how efficient we were, etc. But today it is more of parent or patient reported quality outcomes that is becoming important, and therefore a significant portion of the time will also be spent on how to improve parent reporting quality outcomes. So we have given enough thought in this program to that. We've involved parent support groups who will be talking to us and telling us what we should be doing in order to not only do good surgery or speech therapy, but also make sure that the children end up having better holistic outcomes.